Yesterday we heard from Carl May and Byron Powell as keynote speakers, and now it's time to ask them some questions. So to this panel, we also welcome Dr. Bianca Albers, and the focus of this panel will be theories and evidence, the context and tailoring of implementation strategies. So just for anyone new to the conference today, I'll briefly introduce Carl May and Byron Powell and also Bianca Albers. So first, Carl May is a medical sociologist and implementation scientist. He's currently professor of medical sociology at London School of Hygiene and Tropical Medicine and is an honorary professor at the Department of General Practice and Primary Care in the University of Melbourne. In 2020, he was elected an honorary fellow of the Royal College of General Practitioners in the UK. And Byron Powell is an assistant professor at the Brown School and School of Medicine at Washington University in St. Louis, where he also serves as a co-director of the Center for Mental Health Services Research. And today also we welcome to this panel Dr. Bianca Albers. Bianca is an associate director at the London branch of the Center for Evidence and Implementation. She's an internally recognized implementation expert and a co-founder and past chair of the European Implementation Collaborative. In her work, Bianca focuses on implementation, on improvement and evaluation of research-supported programs, practices and service models in child and family services, and on building the capacity with organizations and services to adopt, use, and sustain evidence practices and policies. Throughout the Implement All project, Bianca has been a member of our external advisory board as well. So Christian will be moderating this panel. So please provide, again, lots of questions in the Q&A function at the bottom of your screen. So welcome panel members and Christian as moderator.
Yes, thank you, Kim. And also a warm welcome to Byron. You're here again. I'm not sure how early it is at the moment in the United States, but you look very awake, so welcome. And we've got, I think, loads of things to discuss. And one of the first questions I'd like to ask to the panel in that sense is how to make chocolate of the results that we have in Implemental. So just to very briefly summarize that, we have an It Fits toolkit, tailored implementation, online toolkit, and we see a small positive effect on implementation outcomes, on normalization. At the same time, we also see that that implementers find it useful. It's something that works. It helps them to use. How should we see this in light of theory, in light of practice? Yeah, one question there. Bianca, can I ask you to reflect on that?
Well, of course, all of this depends a bit on the ambitions with this, but if you take a slightly critical look at it and say, okay, this is let's say, a passive type of implementation support, very much relies on whether it is easily integratable into daily structures, daily routines of busy practice organizations. You could look at, is there more that could be done to make it possible for users to use all the aspects of the toolkit? Tracy yesterday talked about, yes, there is a satisfaction, there is promise in this. At the same time, people, as with all interventions, have a bit of a pragmatic approach to this, and they pick and choose what kind of makes immediate sense. There might be things in the toolkit and what you offer that are more complicated to work with, and I think people have a natural hesitancy towards going to these elements. Is there something that can be done? Support tailoring the toolkit further so it becomes easier to use the entire range. So in that sense, I think there are ways to think about moving this to a more active implementation support type of approach in the long term.
Okay, so that's interesting. And also yesterday we had a little bit of discussion with you, Byron, about expert-driven implementation. And Bianca, you were mentioning that as well in terms of perhaps finding a balance between flexibility, allowing people, let's say, who are really tasked with doing the implementation, designing their own strategy that they think is necessary versus a more active role in it. How do you look at that, Carl? Can I ask you to respond to that perspective?
I can. I guess the thing that I would say about this is that I think the results are what I expected them to be. I did not expect Nomad scores to rise as the enterprise went on, for the reasons that I was explaining yesterday. That of course bits of implementation work become embedded in everyday life. They sort of cease to be visible work, but that doesn't mean to say that they're not being done. What I think operationalizing ITFITs did, and why I think it's valuable, is it's a tool for thinking as well as acting. So using that, I think, enabled people to better understand what they were doing. And of course, when you better understand what you're doing, some things stop being taken for granted for a while, and other things become evident. So the thing about ITFITs, it's not like introducing a machine into a process. It's a conceptual tool, and I guess that although it would be lovely to have a machine that could do this, we could call it the sociotron, and it would enable us to, and it would have a staff of many men in white coats, and so forth. But the kinds of things that we're talking about are not mechanical. They're conceptual tools that are used flexibly and pragmatically, as Bianca's just said. And I think that the kind of pragmatic use of these things is a really important thing to bear in mind. That they're used for local purposes as well as strategic ones. So I kind of think, yeah, there's a lot of data to unpack in the ITFITs evaluation. But those are my sort of working hypotheses about what it all means.
Can I ask a question?
Yeah, sure.
Because, so what I hear you say, Carl, is in a sense you have an optimistic view on this and a patient step-by-step evolutionary perspective on this. And I sometimes, I can see that at the same time experience often in social care that the system strikes back. So an innovation, well-intentioned, initiated, maintained while there's particular attention and funding, then dying its slow death after that 4 years, because people pivot towards getting back to what was normal before, in a sense. Probably not so much with toolkits, but let's say with clinical or therapeutic interventions. And I wonder how you look at that.
I think it's a feature of the ecologies that we're interested in, that there are huge events going on all the time that are not part of the interventions or the context that we're addressing, but which change them. So the obvious one for us is COVID, but there are others too. So COVID, for example, may have intervened to make some aspects of e-consultation seem more normal and more reasonable for patients or service users. But what we know from other studies is that these kinds of practices have become less normal for practitioners. So you have these very complicated sets of relationships between people that are and definitions of appropriateness amongst different groups. So that's how I see it. I mean, I really think that your point about pragmatism is very, very important here, because by and large, most of the people who were operationalizing IPFITs or enacting behavioral cognitive therapy using telemedicine systems had lots of pragmatism and lots of workarounds in what they were doing. You know, they were having to do quite complicated things, and then to embed them not simply in their own practice, but in big legal and jurisdictional and service contexts as well, in a time in which almost every aspect of social life across Europe and Australia was disrupted. You know, global disruption has been the watchword of the last 12 months. So in that context, I think the whole thing went really well. I mean, you know, didn't it? I mean, it was a hugely successful project in the sense that everything got delivered, and in as much as participating sites were able to operationalize their services, then I think it went pretty well. I was pretty chuffed, really, looking at it.
So one of the questions there, for me, is also raised by Yasin yesterday, and I see it in the comments here again popping up, is the, let's say, the limitations to what implementers actually can do, and things that change in the system level or on a macro level, but also just on a perhaps even personal level. And together with that, taking that heterogeneity and of let's say impossibilities across the sites, and given the setting that we had, the question is, for instance, from Dean Fixon saying, is tailoring a good idea in experiments where the aim is to study the effect of a variable there? So this is a very methodological question in that sense, and but it resounds, I think, the difficulty that we have had in this study, trying to, on the one hand, create a setting which is representative to real world, but on the other hand, try to estimate the causal effect. How do you see that, Byron, also in your work in more focusing on the effects of strategies in that sense?
Yeah, I think it's a wonderful question, Dr. Fixon. I think I have a couple of thoughts. One is that there are obviously, as you highlighted yesterday, Christian, so many moving parts here with tailoring, and so I do think that makes that type of heterogeneity makes testing this in trials very difficult. And I also like how you sort of frame this as, in some ways, as a large pilot, and that you were doing a lot at once. So I tend to be, bouncing back to the previous conversation, I tend to be very optimistic about this trial and the results. I think the challenge with all of this work is that if we're trying to tailor strategies over here, we have to also admit that we have many things. If we consider discrete implementation strategies as sort of the building blocks that we're using, we have so much to learn about discrete implementation strategies and how we make them, how we optimize them, how we make them most effective, how we apply those in care. And so in many ways, I feel like we're limited by the state of the evidence for very basic things. And I was reminded of that last night in our class. We were focusing on audit and feedback and learning, and just the journey for a strategy as sort of specific as that, and to see how the evidence has developed, but also to see how much we have yet to know about that strategy. And so I think in many ways, the optimistic part of the trial is that you've built sort of the structure, and as Carl was saying, the sort of platform for decision making in a very pragmatic way that provides the scaffolding for these organizations. But I think the idea of introducing emerging evidence over time to help us to tailor things better is critical. And I think that's both with respect to the development of evidence for individual and multifaceted strategies, but also the notion of how do we best make decisions about how to tailor those strategies to the setting. And so I think some of those methodological questions are yet to be answered, and I think we can do that in a much more refined way over time.
Yeah, I'm still triggered or intrigued by the complexity. Basically, also just the comment that you made, Carl and Bianca and Byron, you also in that sense that not the mechanistic approach, but really the dynamic, constant change that happens basically within teams, within the context, could we say that there is, this is also a question that I think is being raised multiple times at multiple occasions, is what would be the conditions, what would be the right conditions to implement these things on the micro level, for instance, or even on the personal level? Could we think of conditions that might, let's say something about the likelihood that an implementation can be successful? Carl, how do you think about that from a theoretical perspective? This is perhaps a very difficult question. Yeah.
Well, I have been thinking about this problem a lot. When is the right time to do some of this stuff, and what are the characteristics of this? And I talked about this to a friend of mine who is the web-enabled finance services manager of a large private bank in London, and she and I travel into when we go into London, which haven't for a year, but we often sit near each other on the train and talk. And I asked her a question about, how she dealt with these implementation problems. And she said, well, simply we have large call centers, and when we want to make a major change in our processes, we lay everyone off and they can go and find another job. And then we create a new call center with entirely new staff and deliver a major new service. The problem that one of the reasons that implementation science is implementation science is that you can't do that with health professionals because they're too scarce a resource. And the second is that large parts of their work are discretionary. They can't be compelled to do some things. And this is why I think complexity becomes an issue. Because we're not simply looking at back at the beginning. I mean, I used to sit in the office next to Martin Eccles in Newcastle, and we would often talk about why it was that general practitioners wouldn't do things that were evidently sensible in terms of evidence. He was professor of general practice. Now he's a very distinguished artist, but then he was helping to invent implementation science as a field. Now look, where you have people who control their own workload and control the direction of their work, you have to be persuasive and you have to offer them something that they can use. And that I think is the answer to complexity. Where you increase people's workload to no obvious benefit to them, they are unlikely to pick up even the best and most interesting tool.
So it needs to make sense.
Yeah.
I would also, I would, Per Nielsen, he did, together with a couple of colleagues, did a scoping review on contextual thing and contextual factors in implementation, and referred to the work of his family name is Johns. I don't know his first name. And what he described as context was a bundle of stimuli and constraints, which I think is a nice capture of context. also saying it could be anything at any point of time. And in that way, really, I would find it hard to say, so this is like the mother of all optimal context for an implementation. But he then speaks about there are deadly combinations of contextual factors. Something like lack of funding plus lack of leadership is probably not a really good platform for an organization or system to enter into an implementation process. So in that sense, you might be able to describe an ideal context a little bit, but otherwise I would find it really hard.
Okay, so moving to another question I have in the chat here as well from Tim. And obviously, Tim is very knowledgeable of what we've been doing here. But one of the questions, and I think that's equals, I think, multiple talks. But should we need to be more modest about the expectations that we can have on implementation, interventions, and changes that we can have? Like, for instance, we saw yesterday with the farmers examples in Germany. Some things indeed cannot be changed, perhaps, or not at specific times. How to cope with that? Should we include that in tools like ItFits, an assessment of things that you cannot change?
I think I would just say two things. Number one, I think we should have more modest expectations, and I think the challenge here for implementation science is, I guess, Carl, you said it, that, you know, we're on the side of the angels and we want to have impact immediately, and that's obviously central to our mission as implementation researchers and practitioners. But I think one thing to remember is that even very small effects can have, you know, large impact at the population level. And so some of the things that sometimes you look at the effect sizes of implementation strategies and it looks pretty small, but I think we need to not undersell the potential benefit there. And then I think the second point of I think this is really apparent to me is that in some of our work on tailoring, it's like we're not really dealing with things that are central to implementing the intervention. So, for instance, in our work involving trauma-focused cognitive behavioral therapy, a lot of times we're dealing with fundamental issues related to, you know, poor funding, turnover, really poor organizational cultures and climates. Things like psychological safety, leadership, communication. These are sort of core organizational issues. So I don't mean to say they're not related to, you know, implementing TFCBT, but they really are quite fundamental and might relate more to sort of general implementation capacity than, you know, strategic or specific capacity around trauma-focused cognitive behavioral therapy. And so I think, you know, I talked yesterday a little bit about sort of more adaptive approaches to implementation and maybe stepped approaches where for some organizations and systems, maybe the focus really does need to be on that general capacity issue and really building that before we even introduce things like trauma-focused CBT or other evidence-based practices, because otherwise it's sort of, you know, like building a house on sand or whatever, and maybe a foolhardy mission. So all that to say, I think we do need to be more modest. And I think part of the challenge of implementation is that we're sort of de facto dealing with everything in the context. And Carl, I was reading one of your papers with Tracy at 3 a.m. this morning, and you were suggesting that's one of the challenges of context in terms of if we define it as sort of everything in a socioecological sense, a lot of that is just outside the purview of researchers' ability to change things and measure and control things, but it's certainly challenging.
Thanks, Byron. I have one. There is another question. Also, I think it's been raised yesterday. It's about like we've been building in the toolkit quite some flexibility, but this is about the implementation process, obviously. But you also have the same kind of question regarding the intervention fit within the context. and adaptation of that intervention is required in sometimes to make it fit within the needs of the local setting, and that can be part of the, let's say, local tailored implementation strategy. But then raises the question, I think, on two levels or two aspects. So for a specific intervention, how far can you go? What can you adapt of those things? But on the other level, or higher level, is to what extent can we still speak of evidence-based, let's say, healthcare, if we're going to and need to make all kinds of adaptations to the interventions, so to say. And this might relate also to the mechanistic discussion we had earlier a bit as well. But how do you think about that, Bianca, also from your experience?
Yeah, it's a big topic in social care, of course, with many manualized types of interventions existing, and many of them still in some way or the other appearing to be black boxes, where it is hard to say what are really the active ingredients here that trigger the change and what is everything else. And if there were this knowledge, we would be able to say, okay, then let's focus on these core elements of the intervention, and the rest we can adapt freely, so these interventions fit nicely into our context. And there's an entire stream of research, common elements, kernels, those kinds of things that try to get at it. And I think there's, at least in mental health, child welfare, there's exciting work being done in different corners of the world. So I would see that a bit as a way to go for becoming more flexible around the adaptation of interventions, and potentially also, that was said yesterday as part of the keynotes, I think you referred to it, Byron, at the end of your presentation, even for implementation strategies, finding out what are some of the key activities in implementation that we might be able to rely on.
Okay. Then a whole other question, and perhaps, Carl, this is at least one that I'd like to ask you as well. It's been raised in the chat in some sense as well, is how can we close the loop basically from theory to empirics and empirical information that we have in this study, but also in loads of other studies, obviously. So how do you reflect on the findings that we have in this implemental study relating to, I think, two things, obviously NPT, normalization, process theory, but also the concept of tailoring that is being based partly on NPT as well. How do you reflect on that, if any? But yeah.
I think these things depend on the privileges that we're prepared to grant theories. So to my mind, theories are we can think about theory in two ways. We can either say this is a grand, great scheme that orients us to the whole world in some way, or we can say theories are explanations for very specific kinds of phenomena. And I do have theories about the whole world and my orientation to it, and I should just keep those to myself. But if we're saying, well, we want to theorize an implementation process or an activity of tailoring, then we need we need theory with humility. We don't need to sort of work our way through the collected works of Jürgen Habermas or Heidegger or somebody like that. What we need are things that tell us what we need to know about something and explain it. So theories do two things. They enable us to ask particular kinds of questions, and they enable us to explain the results of attempting to answer those questions. And that's their role in work like this. There is pretty much in implementation science is quite unique in disciplines with which I am familiar or work, because of the sheer volume and proliferation of theories, frameworks, and models. A new one appears literally every week. And many of them have very, very thin empirical application and very thin bases in research. A lot of them are do strike me as sort of somebody sitting in the bath thinking, oh, what shall I write next? Oh, I know, I'll do this boxes and arrows thing. And then it'll be true and I'll become famous. The whole business of creating theories, if I had known how much work theorizing actually, if I had known how difficult it was, I would have never got involved in it in the first place. I absolutely promise you that. I would have just done log linear regression for the rest of my life. But here's the thing: if you have an explanation for one thing, it's not theoretical unless it can be applied to all instances of that class of phenomena. Theories are generalizable explanations, and that's their purpose. So, talk about NPT. Well, we can see NPT being used in all kinds of areas of research, not just in healthcare, but my favorite is organic seed production in Mexico. I've always liked that particularly. But irrigation or supply chain logistics, or the implementation of the torture memos by the CIA and things like that. So you kind of then say, well, what species, as it were, of phenomena is tailoring? And what tailoring is modification. We modify things all the time to make them workable in practice. That is a principal human trait, the ability to modify our surroundings, and to modify the tools that we use through learning and imagination. So the question then is, if we're trying to understand tailoring from a theoretical perspective, are we saying, well, we want to understand the implementation of a specific act of tailoring? Or are we saying we want to understand tailoring as a phenomena in itself? And I think if we want to understand tailoring as a phenomena itself, then we need theories about design and creative human activity. And there are plenty of those. If we want to understand comparatively the implementation of different kinds of tailoring, then we absolutely need the kinds of theories that we're talking about today. If we want to contextualize that in complex and dynamic processes, we start to have to federate different theoretical models. And that does that process of federation performs two really important functions. First of all, it maintains the integrity of theories themselves. So the great misfortune that fell the theory of planned behavior was that it was used to explain everything. And so what started off as a theory of that was intended to explain the process of coming out of illicit drug use eventually came to be used to explain almost every aspect of professional activity, and it was never intended to be used in that way. And so the boundaries of that theory were constantly pushed. If we go back to what Tim Rapley asked us, do we need to be humble? Do we need humility and modesty in our expectations of interventions? Yes, we do, but we also need to be modest and humble in our expectations of the conceptual tools that we use to interpret and plan and explain them.
Okay.
That was more of a sermon, I think, than an answer, but there you go.
Bianca, just very briefly.
Yeah, very briefly, I remain to be the grumpy one here, less optimistic, slightly irritated because, and not about you, Carl, at all, but I see sometimes us talking about tailoring, adaptation, and it's this try to squeeze in that intervention so it somehow fits with the context, be adaptive, because otherwise you might not have a chance. And that is so incremental that I sometimes think, so how do we want to make the changes that we want to achieve? Yesterday, Carl talking about, we're on the side of angels. Well, are we? Or are we just slightly supporting existing systems? We're talking in implementation science now about solving the big health disparities in the world, creating more equity. That all is about kind of system change, big change. And is tailoring and adaptation enough for that? How do we enable the meaningful, relevant disturbances that shake the system in a way that it probably doesn't change just incrementally, but a bit more? And all of that, I don't know. Sometimes I'm thinking, is implementation science too conservative, too trying to muddle through, kind of like?
Thanks. I've got, just very brief response. I think this is we can go on for a long time, and it's very interesting. Perhaps we should, I don't know, organize ways of keeping on these debates because I think it's very important also for reflecting on theories. And I very much appreciate your comment, Carl, in that sense. Using it as tools and etc. But trying to understand and methodologically also trying to improve the understanding of it. So still the arrows in your model, I think it would be interesting to see if we can find explanations for that as well. Just as a final closure of this panel, because we need to go forward, I think. Can I ask you to reflect on the implemental project, and in terms of, well, two things. One thing is you've all looked at it from a different perspective, from different, being involved in it from different perspectives. But one thing is, what would you advise people like us never do again? And one thing is, do this thing again, in that sense. Reflecting on the implemental project. Byron, can I ask you to kick off on that one?
You can. I'm not sure I have a great answer for what should you never do again. I think I'm sort of reflecting back to what I was trying to articulate earlier in terms of, I hope that the baby doesn't get thrown out with the bathwater with some of this tailoring stuff. And totally agree, Bianca, that we're probably far too conservative, and tailoring both isn't a panacea and shouldn't just be sort of tinkering around the edges in a way that's incremental in that way. But I think that adaptation and tailoring, or as Carl was saying, modification happens. It's not sort of good or bad. I think these are empirical questions that we need to be much better at tracking, sort of what changes are actually made and what difference does it make. And I don't think that we've done that on a very granular level. And I don't think that our methods are pragmatic enough to do that yet. I think a lot of this is still very resource intensive to track things like what strategies people are using throughout the course of an implementation effort. And so I guess, again, I applaud the effort, and I hope that you take the good and move on. I think I sometimes feel pressured by our funding structures. I don't know how it is there, but here at the NIH and things like that, I feel like you're forced to overpromise and to suggest that you're going to change the world with one study. In reality, I do think things are much more incremental. So my hope is that in our push for impact as a field of implementation science, we don't also lose sort of the space for the more methodological work, again, to sort of develop the building blocks of what we're doing. Because I think without that sort of focus on basic implementation science and theory development and building strategies and methods, I think we're never going to get to where we want to be in implementation.
Thanks. Bianca, can I get your last few thoughts on this?
Yes, and I only want to focus on the positive in this case, because what I really like about what you represent is this Europe as a laboratory for understanding implementation process from a cross-cultural, cross-system perspective. Carl said yesterday that this project made him, in a way, proud again of being European. I feel a bit the same. There's lots to do in implementation science. Your project is a huge contribution to that. And I would really hope to see more projects of this size, this diversity. Great work.
Thanks. And then Carl, to you, the last two. And then I've just been asked to keep it very brief. So I would say one sentence for each of those two topics.
I think the great merit of Implemental has been collaboration, collaboration, collaboration. I think it's a great example of what a good multinational study can achieve.
That's very brief and very short. I fully agree with you. So just from my perspective of knowing the European Commission, about 50% of the budget that goes into even research it should be contributing to collaboration. I think we managed that here to a large degree. Collaboration, and I'm very proud of that actually, on the entire consortium, that we have methodologists, very die-hard methodologists in both qualitative research and quantitative research still talking to each other in this project, and I'm very happy with that. So thanks for your valuable input, and the discussions definitely will not stop here. Also about really trying to understand what has happened in this project and making the most out of the data that we have, the experiences, and going forward to the future. So once again, thanks very much. Wouldn't be as interesting without you.